LASIK surgeons, refractive surgeons, cataract surgeons often hear patients saying, gee, I never had glare before, and now, since you did my surgery, when I look at headlights at night, the signs are glary, the headlights are glary. I never had that before. I always classify that as something I call the new car syndrome. I explain to patients that, have they ever bought a new car? And they look at me and say, well, what are you talking about, doctor? I say, well, if you buy a new car, one of the first things you notice when you drive around the neighborhood is your car. They go, oh yeah, yeah. What? I said, well, you see all those cars because you're in a state of hypervigilance. The dealer didn't suddenly put all those cars out on the marketplace. They've been there. It's just that now that you've bought one or you've participated in the purchase of one, you now are in a state of excitement. And once you notice one, you see them everywhere. And that's the same thing happens after laser vision correction. In fact, the way we demonstrate this to patients is before we do their surgery, I developed a little test called the Glarometer. And what this test does is it demonstrates to the patient that they have glare and halo. And the way that's done is quite simple. I always ask the patients before I start, in the dimmed examination room, I say, well, Mrs. Jones, have you ever noticed that at night there's glare from the headlights, and how far out is it? Oh no, I don't have glare. Or they say, oh, I have tremendous glare. What I've noticed over the years, there's no relationship of what their perception is and what they actually see as glare, as measured with the Glarometer. I then proceed to shine this light in their eyes, one eye at a time, and I ask them, how far out does their starburst go, or do they see a halo, and we record the number. And then actually we do the same thing after their cataract surgery and LASIK, and 90% of the time we can show that it's actually diminished, or at least the same. That helps them get over this period of hypervigilance or buyer's remorse when they're noticing these things that are always there, but they're ascribing them to your surgery.